This is a banded hip mobilization to get more hip flexion, external rotation, and abduction. So this is something that's really going to help you achieve more range of motion in the bottom of your squat, say. Here's how we're going to do it. So this is working on the level of the joint. So when we're working on the joint, we don't want to feel any bad pain, but it may feel uncomfortable. So we want to know, the difference between a feeling of uncomfortable or tightness or stiffness or creating change at the joint versus actually doing damage. Definitely don't want to be doing damage. So if it's a really sharp, stinging, burning, numbing pain, then it's probably not what we're after. So what we're going to do, set the band up so that when we're in a kneeling position, we're at about hip height. Basically from there, we want the band right up in our groin. So we're working on the hip joint. From there, we're going to come forward. We want the band to have a lateral angle back. So we want to be pulling backwards, but also out to the side. So it's sort of going to decompress our hip and encourage it to create change. So we're working on the ligaments in the hip when we do this one. So from here, what we're going to do is we can even have a bench to hold on to. Actually move this. So we can have a bench to hold on to this, right up in our groin. Come down in position. So we've got the band pulling back and slightly laterally as well at the height of the hip. We don't want it up high, we don't want it on the ground, we want it at the height of the hip. From here, we're going to hinge down. We can rest our hand on here. We want to keep a neutral spine. We can rest this other hand on our ankle. We're going to push this knee out, and we're just going to try and create more hip flexion and abduction. So from here, what we're going to do is just deep breaths. Deep breath in, let it fall in. Super deep breath in, let it fall into more of a stretch. So depending on your sort of systemic flexibility score is going to depend on how long you hold this for and how long, how quickly the change is created in your joint. Just want to hang out here, super deep breaths, and let that basically let the knee fall out, create more hip flexion, and create more movement at the joint. So when we come out of that, when we say go into our squat, you can actually feel, all right, cool, it's actually created change. So that is a band mobilization for hip flexion, abduction, external rotation.